Hi, my name is Lauren Faust. I'm a unit director here at Ochsner. I'm excited to share with you our journey into Bedside Handoff. As with any new initiative, it's going to be challenging and there will be barriers that we have to face together, but I want to tell you how rewarding it's going to be for your patients and your team. It is very exciting to see that this is a process that can actually hit each one of our core values. We're putting our patients first and keeping them at the very center of their care. We're embodying compassion as we honor our commitment to ensure our patients are informed of their plan of care. We exhibit integrity by providing a thorough and accurate report and preventing communication breakdown, which can cause harm to our patients. We exemplify excellence by sharing our knowledge and expertise and allowing our patients and their families to ask questions. Lastly, this has accelerated our teamwork to ensure that we're holding each other accountable and supporting the development of our new team members. Consistency is going to be key to success. You'll find that bedside handoff is actually reduced in time when done consistently. It's going to be important to share the how and the why with your teams. The why is simple. It puts our patients first and it helps us to build our teamwork. The how will be displayed in this video. I want to say a special thank you to the volunteers who supported us in making this video, and we look forward to hearing any feedback on how we can improve. Thank you.
Brittany, your nurse, I have Jennifer with me. Is it okay for us to come in?
Yes, ma'am.
Hi, good morning. How are y'all doing?
Good morning.
This is Rachel and her mom, Mrs. Robinson.
Hi, nice to meet you.
Rachel, Jennifer's going to be a nurse today. She has been working with me for over a year. She is an excellent nurse, and I know you'll be in great hands.
Thank you.
Oh, thank you.
As we spoke this morning when I rounded at 6 o'clock, for your safety, we do practice bedside handoff. Is it still okay for us to speak in front of your mom?
Yes, ma'am.
Okay, good. We do use electronic records, so we will have a computer in the room. Feel free to interrupt us as needed if you have any questions, okay? But first, before we get started, I just need to check your armband to make sure we have the correct chart pulled up. Could you please tell me your first name, last name, and date of birth?
Rachel Jones, 1190.
Good. Okay, great. So Rachel is 26 years old. She was admitted to us with abdominal pain, nausea, and vomiting under the service of Dr. Smith. Rachel, has Dr. Smith or any of his team members been around yet this morning?
No, not yet.
Good. Well, they should be around between 8 and 10 this morning.
I'm looking forward to going home.
Well, we hope we can make that happen for you today.
Okay.
Rachel is allergic to morphine with a reported rash. She is a full cold. In addition, she has been up with assistance. She has a history of colon cancer and had bowel resection 3 years ago and has been cancer-free for over a year. She has suffered from recurrent bowel obstructions over the last couple of years. This is her third day with us. We have removed her NG tube about 2 hours ago. If she does well, we'll advance her diet and hopefully plan for her discharge today. Rachel has a 20 gauge in her left hand with normal saline at 100 cc's per hour. We're going to take a closer look at that, okay?
Yes, ma'am.
Great. That looks good.
Her pain had been controlled with Dilaudid 1 milligram IV, but the plan is to start Percocet by mouth today. Her last dose of Dilaudid was at 5 a.m. Rachel, how would you rate your pain right now?
I would say a 2 or 3.
Great. Your next pain medication is due at 9 a.m. That's your Dilaudid. I'm just going to update your board so you know what time it's due.
Okay.
Your next dose of Dilaudid is 9 a.m. As you stated, your pain level is now a 2 from a 4.
She is also a low fall risk, up as needed with assistance.
I don't think I'm a fall risk.
Well, actually, here at Ochsner, safety is our #1 priority. We want to make sure that you're up with assistance only. We don't want you getting up on your own. Things like the IV poles, the equipment in the room, and the pain medications you're on can actually make you a fall risk. So we don't mind. We prefer to actually get you up if that's okay.
Okay, that makes sense.
Rachel, if you are discharged today, would you have a ride home or someone to help take you home and get you settled in?
Yes, I'll take her.
Great. Rachel has been comfortable throughout the night. Her biggest discomfort was the NG tube, which is now out. She is alert and oriented, and the rest of her assessment is pretty normal. I have been with her for the last 2 nights. She has improved bowel sounds and reduced abdominal tenderness. Rachel, we are going to look at your abdominal dressing, okay?
Okay. That's fine.
Okay, Rachel, we're going to take a look at your incision. We're just going to take a peek. We're not going to expose you.
Okay.
Okay. Oh, yeah, your incision looks good. It's clean, dry, and intact. The dressings, the steri strips, they're on there tight, good, no drainage. That's what we like to see.
Great.
We're just going to take our gloves off and perform hand hygiene, okay? So So she has ambulated to the restroom. She is urinated and had a bowel movement.
Okay.
For today, the plan is to advance your diet, change your pain medication from IV to oral to ensure that you have diet and pain tolerance. She does still have IV fluids. Maybe you could reach out to the team to see about getting those things discontinued.
I'll check with them.
Rachel, do you have any questions? Is there anything else that Jennifer should know to take care of you today?
No, Mom, you have any questions?
No, I don't. Everything was wonderful.
Thank you.
Before we go, you did say your pain was at a level of a 2. I just want to confirm that it's still at that level.
Yes, ma'am.
Great.
I just want to remind you, you do have that 9 a.m. Dilaudid you can have upon request.
Okay, thank you.
Rachel, do you have a full, clear understanding of your plan of care?
Yes, ma'am.
Great. Well, thank you for allowing me to take care of you for the past 2 nights. You are in great hands. Jennifer's an excellent nurse, and I really do hope you get to go home today.
Thank you.
Rachel, I'm going to go get report on my other patients and round them right now. Is there anything I can do for you, get for you right now? A drink of water, take you to the bathroom?
No, I'm okay, thanks.
Okay, great. Denise, our tech, she's going to be in here in just a few minutes. She's going to alternate the rounds with me every other hour. You're going to love her. She's got a great personality, and she's been with Ochsner several years now.
Okay, thank you.
All right, thank you.
They were very informative.
Best hospital I ever had. Nurses is wonderful.
Yes.
Hi, I'm Tracy Moffitt, your System Chief Nursing Officer and Vice President for Quality. I want to thank you for undertaking this transformation in the way we exchange information at the patient's bedside. By involving the patient in this process, we will dramatically improve the patient experience. Equally important is that we will have an impact on the patient's quality and safety at the bedside. I want to particularly thank our Integration Council members who work directly with many of you in designing the process. And in doing so, I think that you will find over time it is easier than the current process. As you begin your handoff at the bedside, I'd like to remind you to please wash your hands or foam in as you enter the patient's room. Be sure as you're going through the change of shift that you refer to the whiteboard and that you manage up to the person who will be assuming care of the patient in the next shift. Lastly, as you leave the patient's room, please be sure to offer them a drink of water or perhaps a trip to the bathroom. And lastly, be sure and wash your hands or foam out as you leave the patient's room. Thank you again for undertaking this important initiative on behalf of our patients.